Hello and welcome to Healthy Nation. I'm Pat Murphy. Every day, more than 16 million adults over 40 struggle to breathe because they have a condition called chronic obstructive pulmonary disease, or COPD. Now, there are some hereditary causes for COPD, but about 85% of cases are directly related to smoking tobacco. Let's hear from Dr. Holly Atkinson about how the lungs are affected by COPD.
When we breathe, air is pulled into and pushed out of the lungs. But when you have COPD, that transfer of air and even just breathing becomes difficult. Again, COPD stands for chronic obstructive pulmonary disease. In plain English, that means a long-term blockage in the airways. Most of the time, if you are diagnosed with COPD, it means you have bronchitis or emphysema that won't go away. There's also a third type of COPD that results from chronic asthma. That can lead to both immediate and lasting damage to your lungs and body. But before we talk about the effects and treatment for COPD, let's go inside the chest and see what happens as we breathe. When we breathe, air enters the lungs and moves through small tubes called bronchial tubes. At the end of each of these bronchial tubes are small balloon-like sacs called alveoli. These are filters between the air in the lungs and the blood that moves throughout the body. The thin walls of the alveoli allow oxygen from the air to go into the bloodstream and carbon dioxide to pass from the bloodstream into the lungs to be exhaled. This is what keeps the body's cells alive and functioning. When you have COPD caused by emphysema, the alveoli filters become damaged. First, their elasticity becomes reduced, limiting the ability for the alveoli to move as you inhale and exhale. Second, the alveoli become permanently enlarged, which increases the overall size of your lungs and puts greater strain on your chest muscles to breathe in and out. When you have COPD caused by chronic bronchitis, the bronchial tubes become inflamed and enlarged. This can narrow the airways. The air passageways can also become blocked because of increased mucus production caused by enlarged mucus glands. And finally, the cells that help move mucus out of the body can become damaged, reducing your ability to clear mucus from your air passage. More than 85% of COPD cases are caused by smoking tobacco. That's because a chemical in smoke stimulates inflammation in the lungs, leading to either chronic bronchitis or emphysema. Heavy smokers are at the greatest risk, and cigarette smokers have more risk than cigar and pipe smokers. The remaining causes of COPD are either unknown or, in a small number of cases, about 1 or 2%, are due to a hereditary condition known as familial emphysema.
COPD can make breathing extremely difficult, even under the easiest conditions. Watch our other segments to learn the signs, symptoms, and treatments available for this condition.